Welcome back. Thank you so much for staying with us. And now it's time for the interview segment. Like you know, on Thursdays, we always bring to you health-related information. And here today we have our guest, dentist Racheal Babayomi. And she wants to take us on the impact of oral health on our general well-being. Thank you for joining us this morning.
It's my pleasure.
Thank you. Welcome to the show.
Thank you very much.
Well, we always hear about oral health, oral hygiene, and most definitely we know that oral health is not just related to brushing of teeth. So many people argue that you brush your teeth twice daily. Some will even say 3 times daily and all of that. So let's have your own definition of oral health. What is oral health to you?
Okay. Basically what oral health is like an umbrella terminology. Okay, and what it simply entails is the absence of disease for one. So that means there is no pain, there is no discomfort or any form of embarrassment from the mouth or facial structures basically. And then this also helps to maintain whoever, maybe the patient, the people, helps to maintain their self-esteem, their confidence. There is no disturbance of day-to-day activity basically from oral and facial structures. So that's basically what oral health
Okay,
is.
if I'm to come in now, let's relate oral health to our general well-being.
Okay.
An average Nigerian, or probably I'm speaking for someone out there, will feel like, okay, it's my teeth, it's my oral whatsoever. So what's the connection between our oral hygiene and our general well-being?
Okay, we always like to emphasize that the mouth is the gateway to the body. So usually if something is wrong with your body, there's a very high tendency that it will reflect in your mouth. Okay, so there are certain conditions that one could have. For instance, there's something we call gastroesophageal reflux disease. That's something that goes on with your digestive system. And then when one has that kind of condition, usually dentists, like doctors like myself, would see a certain pattern of erosion, like wearing of the surfaces of the teeth in your mouth. And you may not know that you have that condition, but when you present to your dentist and we do a thorough examination in your mouth and we see such a pattern, we can tell you that there's a tendency you have this condition, and then refer you appropriately to the specialist that will handle it. That's just one of the many things that one can have that would reflect in the mouth. Okay, you can also have ulcers that show that something is wrong somewhere, or a certain kind of breath that you have that it shows that maybe there's something wrong with the kidneys and all of that. So the mouth is like a mirror of what is going on in your body. So that's why it's very important that we do everything that we can, follow all the principles to ensure that we have and maintain a good oral health.
Okay, talking about examination.
Yes.
How many times do I have to go for dental checkup? Like, basically, so many people will say, there's nothing wrong with me, so I don't really need to go to the doctor to check up anything. So how many times do I have to go for dental checkup? Okay,
we usually advise that you see your dentist at least twice a year. And the reason why we advise this is because if you come in twice a year, there's a tendency that if anything has started to happen, we are going to be able to identify it and then nip it in the bud so that it doesn't progress to become something you may not be able to manage in the long run. So we always advise that you see your dentist at least twice a year, every 6 months.
And then can I ask that during the process of seeing my dentist twice a year, let's say that's once in 6 months.
Yes.
Okay, I have a checkup now. What do I expect? Or did I just open my mouth and...
It's safe to ask us, when you go for your body examination,
yes,
to see an ordinary doctor, I need to check up what's wrong with me. So we need to know. Now, checking up, it sounds, I don't know, to me, it's an average Nigerian. You just tell someone, I need to check my teeth. There's this way they look at you like, why is this one? What are you feeling like? Checking teeth, like, what's up? So I think you should just run us through the basics.
Okay, I think the first thing we need to eliminate is the idea of seeing a dentist is just about your teeth. It's not just about your teeth. Like I mentioned earlier, it involves all your teeth, your tongue, the other structures in your mouth, the soft tissues, as well as your head and neck. So it's very important that you see your dentist, because if anything is wrong with your head and neck, it's your dentist that is going to identify it, not likely your regular doctor. Just like you will go to the hospital to have your regular screening done, you run some tests, blood tests, they do some x-rays and all of that. It's the same thing that's going to happen when you come to us. We're going to examine you chronologically. Look into your mouth, check your facial structures to be sure that there is nothing wrong. And if we identify or notice that something is wrong, then we can tell you what you need to do, tell you the investigations you need to do, and then take it up from there and get you treated.
Okay, let me ask again. Okay, is it because now everything that goes into our body, goes through the mouth?
Yes.
So is it because of all those stress? You know, the eating, the chewing, you know, the swallowing, everything that goes here, you know, how we crack the bones, and a lot of things we do, a lot of exercise we do with our teeth. Is it because everything we consume goes through this place? That's why it's important for us to see. Because personally, as I'm sitting here, as I'm sitting here, you know, I don't think it has really occurred to me. Even when I had a swollen gum. Okay. You know, a typical African, even African moms, you know, they had all these basic, okay, do this, use the hot water, just gargle some, do this, and then before you know it's gone. It's gone,
yes.
And then I've even heard someone told me that, you know, you don't need to brush your teeth daily. That the Oyinbos, like they would say, the white one that said you should brush your teeth didn't specify whether it's morning, afternoon, or night. Just brush your teeth daily. So maybe I should start from the last one. So when, like, what time or how many times do we have to brush our teeth?
Okay, so that's a very good question. What the book says, we do things by the book. Okay, what the book says is you should brush your teeth twice daily. Now there's a specific time to do it twice daily. In the morning after you have your breakfast. So you have your breakfast, yes. Then you do your toothbrushing after breakfast, and then last thing at night. Last thing at night, just before you go to bed, is when you're supposed to do your toothbrushing. So that's the ideal thing to do in.
Wait. I'm sorry. I know I could ask something.
It feels weird, right?
Yes. Okay, let's say I'm not a breakfast person, or I take my breakfast in the office.
Okay.
Is it ideal for me to pack my toothbrush and my...
You don't necessarily have to. You have to understand how your own schedule works. The most important thing, actually, what we try to emphasize to people is your night brushing is like the major thing for you to do. The night brushing, yes, because you've done a lot of eating in between the day. You've eaten, you've taken junk, you've taken a lot of, you know, a lot of things have gone into your mouth. So it's very ideal for you to do your toothbrushing last thing at night, because it helps to remove all of the debris that ordinarily would, you know, stay overnight with you in your mouth. And because of that tendency to, you know, cause a lot of damage in the course of the night, we want you to take it out just before you go to bed. So if you wake up in the morning, you don't necessarily have breakfast, you can brush your teeth before you leave the house. It's not a high and fast rule that you must eat first before you brush your teeth up. Yes, like before you do that toothbrushing. But the ideal thing is to brush twice a day.
Yes. Now we're talking about brushing twice daily. You know, when we were growing, some of us, our parents used to chase us around and go and brush your teeth. You understand? So, and they feel that if we do not brush our teeth, it's called poor oral hygiene. Is there anything other than not brushing of your teeth that you also call poor oral hygiene? Is there something attached to it?
Okay. Poor oral hygiene is a very umbrella term, like I said. Now, people can come to me in the clinic and, you know, they tell me, doctor, I brush my mouth every day, but I don't understand why I have so much accumulations in my mouth. One of the things that usually would cause that, you brush every day quite a while, but are you using the right toothbrushing technique? If you are using the wrong toothbrushing technique, you're still going to have debris that would, you know, eventually become...
There's a technique. Technique. I think I really need the technique. So what's this way? Let me tell you what I know. Okay. So, but I stand to be corrected. Thank God we have a doctor in the house. Okay, I've heard somebody. I don't think I practice it, but what I do personally, when I brush my teeth, I don't rinse with water.
Okay.
You know, I just brush with my toothpaste normally, and that's it for me. Then I clean my toothbrush. So somebody was saying that someone said it's correct. And that person said, no, that's not the way to brush. That in fact, there's a way you...
Yes, that's actually the technique I'm talking about. The movement.
But we do this. We do this. We do this.
There's even someone that told me that it is good to use warm water when you are brushing your teeth.
And then when you're brushing, you know, you should get to a level where I think I watched my dad. Anytime my dad is brushing his teeth, you know, there's this feeling like it wants to vomit or something. You know, when you wash your tongue, you need to put it down, and then, you know, and I'm like, okay, we grew up doing that. But when I got it, I said, I cannot come back to anything. So I don't know. So someone else said, you know, there's this side of the toothbrush.
Okay.
That's what you use for your tongue.
Okay.
So I want to know if we are correct.
Well, there are some school of thoughts that would agree with you. Okay. But there are still other schools of thought that would tell you that you need to still use the bristle of your toothbrush to do the brushing. Okay, so either one will work, but I'm of the opinion that it's better to use the bristles than to use the back of the toothbrush. Now, some of the back of your toothbrushes are shaped like tongue scrapers. Some are not. Yeah. So it's almost impossible for you to be able to tell which one is and which one is not. So it's just ideal that you just use the bristle that you are sure will actually do the cleaning for you and just brush your tongue.
So are you telling us now that preferably the technique is, you know, you have to go up and
okay,
down?
I haven't said that now. I'm just going to tell you. I'm just going to tell you how to do that. So I usually use this analogy, especially on my social media page on how to brush your teeth. I always say that, okay, when we're young, first of all, the type of toothbrush. When we're young and we're told to sweep the compound, if they give you this, you know, there's this broom that is very hard, very hard ones. If you attempt to use that broom to sweep the compound, there's a very high tendency you're going to be frustrated. But usually when we use the very flexible ones, that it's always very nice, and then you see this pattern on the floor that even tells you that you did a good job. So that is one thing we need to identify. Using a hard toothbrush doesn't make your mouth clean. It just frustrates your efforts.
Oh, you're talking to me.
It just frustrates your efforts. So you have to use a medium texture toothbrush. That's for adults, and then soft bristle for children. Now for the technique. If you want to brush your upper teeth, you usually tell our patients and people in general that you keep your mouth open because you're trying to sweep. Just imagine that sweeping that you're doing. You're trying to sweep your teeth. So you start from the gum line. You put your bristles of your toothbrush, usually I would say at a 45-degree angle, but I don't want to bore us with too many numbers. So just put the bristles of the toothbrush at where the gum meets the tooth, and then you sweep it out. So you do that for all the surfaces of your teeth, round, the upper one, ensuring that your mouth is open. The ideology is when you sweep it off, it goes into your mouth, not rest on the lower teeth. That's why your mouth has to be open. Then you do the same thing for the lower ones as well. So for inside of the mouth, the same technique applies. You're sweeping from the gum line all the way up. So you're sweeping out from gum outward, and then you sweep, clean the surfaces of the biting surfaces.
How long will this take?
2 minutes.
2 minutes to sweep. So sweep this teeth.
2 minutes and you'll be done. So instead of doing all of this really doesn't take out the dirt. It doesn't take out the debris. You're just rolling it back and forth. You're not really sweeping it. But if you go from the gum outward, you are actually doing the sweeping motion.
Oh, you know when we do this, I'm trying to say what I used to. Sometimes when you feel like your teeth isn't clean enough, you use your tongue to like feel it. Okay, if it's clear, it's like, okay, I've done a good job. But if it's still, there's a way it's like,
yeah, I know.
Then you feel like, no, you still need to brush some more. So I really want to know, okay, how do we know if it's clean?
We usually would say that you should do at least 15 strokes on each segment. So you do 15 on each segment as you're doing. So you know, ideally when you put your toothbrush on your surface, you're covering about 3 teeth at a time. So you can do the 15 on each one, and trust me, in 2 minutes you're done.
Oh,
yes.
15 strokes, and in 2 minutes
yes.
done.
Oh yeah, there's another thing I really want us to talk about. And I can see, you know, when you've been talking, I was just looking at your teeth. You know, first of all, it's shiny, it's white, and every person, especially ladies, we love to keep white teeth.
Yes.
You know, it's just, especially when you have good dentition and, you know, you always want to flaunt it. I can see you've been doing a lot of that. Anyway, we appreciate you.
Thank you.
But then, now, if we really want to, let's say, whiten of teeth, I think some people grow up with not having their teeth white. I think they were born with, I don't know what happened. Maybe during treatment they use some herbals or something. But then if we're talking about whitening of teeth, to me sometimes I feel like it's really not necessary. Maybe you're doing too much, you're just, you know, this is your fashion thing, you just want to. So what's it about whitening of the teeth? What's that with, you know, braces and a lot of things that goes on there?
All right, let me start with whitening if I go to braces. Okay, for whitening, basically, one thing we need to realize is people tend to function better when their self-esteem is good.
Yeah.
So if people feel like their teeth are not as bright as they would want it to be, of course they will look for treatment. Now there are different factors that could necessitate one getting tooth whitening. Some of them are, we call them either extrinsic or intrinsic factors. Okay, extrinsic are that, you know, over time your teeth have accumulated a lot of dirt or stains and you've found it difficult to take it off. So we will do the taking off of the stains and then whitening your teeth a couple of shades brighter. For the intrinsic as well, it's almost the same principle, just that the technique is different. It's still whitening anyways, but we try to identify what is causing the discoloration from inside of the tooth, take whatever it is out, and then, you know, bleach it from the inside out. So whiten it from the inside out. So whitening is not a bad thing, you know. If it's going to boost someone's esteem, then the person can get whitening. Of course, it has a side effect, but it's not that. It is not that the side effects cannot be managed.
How would it have?
It has. One of the major side effects is sensitivity. You know, you're going to have this sensitivity. But usually, with the way products have been made of recent, like the most recent products that we have, after a couple of, maybe days or weeks at most, all of that goes away, and then we have, you know, substances or products that you can apply over the teeth afterwards that would help with the sensitivity. So whitening is a good option. Now for my teeth, now this is how the Lord made me. Okay, so I know that a lot of people have malocclusions, and when your teeth are not as arranged as mine, and then so usually there's a ton of treatment options, and one of them is the braces option. Now a lot of people may not want to have the typical braces, which are like the metal, some people call the metal gates on your teeth because of how it looks. But because of evolution, we have a lot of other options, especially for celebrities or people who are very conscious, like presenters like yourself, that you can get, that you can be on air and no one even knows that you have those appliances on. And you know, at the end of the treatment, we usually say that you end up having a better smile than we that have natural smiles have. You understand? Because your treatment is going to be streamlined in such a way that we want to give you the perfect smile. The perfect smile that will give you that confidence that you have been looking for. Yeah.
Now let's talk about toothpaste.
Okay.
You get toothpaste has always caused issues. Sometimes in the lives of married couples. I remember when I newly got married, I was telling my husband, no, this is what I use, and he was saying, no, this is what he wants us to use. You understand? Now, what do you think we should look out for in toothpaste? You understand? Because there are so many products out there, and of course, one wants to outshine the other. So what would you tell us to use?
What we majorly tell people to look out for in toothpaste is the presence of fluoride. If the toothpaste has fluoride, we're good to go. Now, I know there are a lot of people who go around publicizing that fluoride is not good and all of that, but the truth of the matter is different things apply to different climes. Even in Nigeria here, there are some places who will tell them not to use fluoride containing toothpaste. Why? Because they already have a lot of fluoride in their water systems that they usually, you know, we take water from. So we advise those set of people not to use fluoride containing toothpaste. But in this place, Lagos, Abuja, Calabar, Port Harcourt, you know, major cities basically, we advise that you use fluoride containing toothpaste. There are only exceptions like Maiduguri and Jos where we tell them not to use fluoride containing toothpaste. So if you are using fluoride, okay, the reason is because for those in those areas, they have a lot of fluoride in their system, in their water. They take communal water. So even if you look at the way they are, sometimes the fluoride they have is in excess. So we don't want to add any extra to what they have. But here we don't have a centralized form of, we don't take water from a communal stream. We all have bottled water, seaway water and all of that, that everybody takes individually. So we don't have like a collective amount of fluoride that we can say each person is getting. So we want you to have enough fluoride because fluoride, you know, fortifies your teeth. That's why we want you to have fluoride. So if you want a fluoride, if both of you are fighting over fluoride containing toothpaste, please go ahead and be mixing it. It's fine.
Okay, let's talk about diseases that are really associated with poor oral hygiene.
Okay.
First off is the most common one is this mouth odor. Okay. And you know, some of them, like you said, you know, if you don't really have confidence in yourself, there are things that will limit you. You know, some people will not want to talk. They don't want to, you know, they just want to be in their shade. They don't want to talk to anybody. And I've had a couple of friends that, you know, they had it, but they feel like this is not going to be. Exactly, this is not going to cost anything, but you know, one way or the other, we had to introduce a lot of things, and I don't know whether it worked or the way they used it didn't work. So first off, let's talk about general diseases that are really associated with poor oral hygiene, then maybe we'll talk about this body, because you know, if we are here, we're having a conversation, and you know, there's the way somebody was saying that, you know, there are slangs that you can use to tell somebody that, you know, it's oozing, you know, when it's oozing, and you know, I need to like want to do some cover up and all of that. So how can we help all of those?
Thank you. So I will start with what you mentioned, bad breath or mouth odor. What we call it in our terminology is halitosis.
Okay.
Now, there are a lot of factors that could play out that could result in one having mouth odor. Now, this will lead me to other things that could be found in the mouth. One of them is the presence of a buildup of plaque and calculus. Plaque and calculus is just an accumulation of, you know, bacteria that have built in where I try to make it very simple, built houses on the surfaces of your teeth. So you usually see like these yellow bands or black bands at the margin between your gum and your teeth. So when you have a lot of that, there's a tendency for that to produce a bad odor. So the treatment is to get that sorted out, to remove it professionally in a dental clinic. Another thing is when, you know, one has holes in the teeth. When you have holes in your teeth like that, there's a tendency that that also produces an odor. You have to get that treated in a dental clinic as well. Other things could be ulcers, presence of ulcers in the mouth, or injuries that have refused to heal, or presence of tumors or cancers. And also, apart from things structured inside the mouth, it could also be as a result of something going on inside the body. Like I mentioned earlier, the mouth is really the mirror. So if you have issues going on in your digestive system, with your kidneys, with your liver, all of those things have specific smells that they produce out. So it's always ideal to, you know, see your dentist, and then we are able to refer you to whatever department, depending on the aroma that is coming out. You understand? So we're able to refer you to the appropriate quarters to have that sorted. So like I've mentioned mansions, bacterial mansions in your mouth that would cause, you know, bleeding diseases, bleeding gums, or what we call periodontal diseases. Okay, periodontal disease is basically gum diseases. Okay, that could result in, you know, your teeth falling out and all of that. So all of these things are things that could be treated by your dentist when you actually see your dentist.
So when people have a conversation, when people talk, and then there's this, I don't know what I should call it. I don't know the English, whether there's a term. No, not oozing in particular. You know, when you talk and then there's a lot of saliva, you know, coming out while you have the conversation with people. You just spills and spills. It's not like it's intentional, and it's not like you're speaking aggressively or something. It's just normal. Is it a condition?
Yes, it is. So you can have too much salivation. You can have too little salivation, or no salivation at all. Okay, now there are different arms to this dental health. There are like 10 different subspecialties. So there's one specialty that handles hypersalivation, or anything that has to do with, you know, production of saliva in the mouth. Now, when one has too much saliva, there usually is an underlying cause that goes beyond just the mouth. It could be from, you know, maybe salivary glands around, or from, you know, other systems in the body. And usually, for you to have that sorted, of course, you cannot do any home remedy to get rid of that. We have to come to the clinic, you know, get examined, and then we'll find out the cause and eliminate it.
Okay, now just the way we've been talking about oral health, we've been like kind of associating it with adults. Let's talk about babies now. Toddlers. You know, sometimes it's always difficult for you to get a toddler to come brush your teeth. You always have to drag, play, and all of that. What do you think we can do to make it easier? Because some of them will just squeeze your mouth, they don't want to and so even sometimes when you just play a cartoon, okay, just watch, just to at least just to make them open their mouth and all of that, and
somehow you feel like you're not doing
well. Some even have to swallow the toothpaste even after you tell them, spit it out. So what way do you think we can use to do this, at least just to make it easier?
Okay, what we usually advise is that we, you know, develop what we call a dental home for these children. Dental home in the sense that you introduce them to oral hygiene practices very early. So we start from when mothers are pregnant, we try to educate them. Okay, when you start breastfeeding these children, ensure that you clean their mouth after each breastfeed. So the child has it somewhere in his head that, okay, after I finish enjoying my breast milk, my mouth is going to get cleaned. Okay, when the child also erupts the first tooth, we want you to start brushing that particular tooth using a soft bristle toothbrush and rice grain.
The one tooth?
That one tooth, yes. You start it from then. Do you understand? Also, you see your dentist immediately the eruption happens, so that, you know, we can, you know, put you through on whatever challenges that you're going through, be taking care of the child at that point. Okay, so we want you to, you know, do the cleaning of that one tooth. As each tooth is coming out, the child already has it somewhere in his head that I have to brush my mouth either ways. So as the child grows up, becomes a toddler, at some point the child is likely going to be asking, Mommy, I want to brush my mouth. Mommy, you've not brushed my mouth this night. Mommy, you have to brush my mouth this morning. Do you understand? So it's already an inculcated habit in the child. Now, for those who do not have the habit formed already, what we usually try to do is to, when they come to the clinic, we try to teach you rhymes, or, you know, introduce you to, you know, there are many you know, videos on YouTube you can use to teach these children. There are even books now that you can read to these children that, you know, teaches them how to, you know, inculcate a good oral hygiene practice. So these are the things that you can do for children who do not already have the inculcated habits, because the idea is to ensure that you know, train them early so that they do not develop problems later in the future.
Okay, away from toddlers now. Okay, so I really want to ask, I'm curious, what's up with this breath, early morning breath?
Okay.
Some people, I've heard people say, I can't swallow my saliva in the morning when I wake up. Some people will say, I can't talk to anybody when I wake up. I know I need to do some things. But then, early in the morning, if you do this, like, you know, I don't know whether is that natural?
Yes, we call it physiologic bad breath. It's just physiologic
happens
halitosis.
to
It happens to everybody. If you don't brush your mouth last thing at night, you're going to wake up with physiologic halitosis. And the reason why you develop that is, like I said, if you leave food debris in your mouth overnight, you have bacteria that live in your mouth ordinarily. I tell my patients, they are going to do a party in your mouth overnight. And what that means is they are going to feast on what you left in your mouth and produce a lot of acid. Yes, they're going to produce a lot of acid. And because we're talking like this during the day, there's a lot of saliva flowing through your mouth to wipe off whatever it is. But at night, the saliva flow is really reduced. You're not doing anything. So the bacteria, they're going to have a wild time. And then when you wake up, you're going to be producing the odor of those byproducts.
Quickly, can I ask this? Is there a side effect, or does a swallowing toothpaste has any side effect whatsoever? Okay,
for adults, not really. Okay. For children, we don't want them ingesting too much toothpaste. That's why they have their own toothpaste. Yeah. So if they swallow their own toothpaste, there's no problem, because the amount of fluoride in that is reduced. Okay. So we don't want children swallowing toothpaste. So you can't use your toothpaste for your children. Okay. Yes.
Okay.
But then, before we go, I just want to tell us what some do's and don'ts. For our wellness.
Okay, so like I mentioned earlier, first of all, you have to brush your teeth twice a day. After breakfast in the morning and last thing at night, using, for adults, medium textured toothbrush and fluoridated toothpaste if you are in this climate. Okay, apart from that, you also need to use the right toothbrushing technique like I mentioned earlier. Another thing you need to do is to ensure that you floss at least once a day. That's, you know, using a floss to take out whatever remnant is in between your teeth. So, and then you have to see your dentist at least once every 6 months, so that we nip anything that is going on in the body.
Well, as we wrap up the program now, so I'll just ask, so do you think all of this that it doesn't cost so much?
All of what?
All of this do's and don'ts. Because some people are doing this, the flux, everything that you just mentioned.
It's cheaper to do what I just said than to come down with the actual disease. And the further the disease progresses, if you don't arrest it earlier, the more expensive it gets. So it's cheap to buy toothpaste and
it's stress-free, right? Because some people don't like stress.
It's stress-free. It's stress-free.
Thank you so much for your time on the program.
That's all we have for you today. Thank you so much, Dr. Racheal.
Thank you very much.
We don't really want it to go.
The size of the teeth, there's something about dentists, and I think, I'm holding you. I'm watching out for you. You're not showing the viewers your teeth to show. Yes, she's a dentist. And yes, I'm not a dentist, but I have good setup.
Okay. Alright, that's all we have for you. We'll go to a short break now, and when we come back, Daybreak Africa continues. Please stay with us.